Poisonous insects. Then another topic related to maggot therapy, not related to this topic, but still we are going to learn these topics together. The natural world is filled with a fascinating array of insects, each playing a unique role in the ecosystem. Among these species, some insects have evolved to possess poisonous qualities as a means of defense against predators. Unlike venomous insects, which inject toxins through bites or stings, poisonous insects are harmful when touched or ingested due to toxins present in their bodies or secretions. The stinging insects are members of the order Hymenoptera of the class Insecta. These venomous insects possesses the capability to sting using a modified ovipositor found on the terminal end of their abdomen. The three medically important groups are the Apoidea, bees, Waspoidea, wasps, hornets, and yellow jackets, and Formicidae ants. Additionally, blister beetles, Lonomia obliqua, monarch butterflies, etc., are poisonous insects. Poisonous insects utilize their toxic properties primarily for protection, deterring predators through adverse reactions. These reactions can range from mild irritation to severe systemic effects depending on the insect and the type of toxin involved. The presence of these toxins often give these insects vibrant warning colors signaling their danger to potential threats. Honeybees. The family Apoidea include the social honeybees, the solitary bees, and the bumblebees. Honeybees are herbivorous and live on nectar and pollen. A honeybee can sting a person or predator using its stinger. Honeybee stings are quite painful and even life threatening to a small percentage of people who are allergic to the venom. Honeybees usually sting as a way to defend themselves or their colony. When a honeybee stings, it releases an alarm pheromone to alert the other workers in the colony. The result is that other bees are recruited to the area to defend the colony as well. Bee venom is a complex mixture of peptides, proteins, and histamine. The stinger is barb and located at the end of the abdomen. It is tied to the digestive tract of the bee, as is the venom sac that produces the venom. When the honeybee stings, its stinger, the venom sac, and other parts of the honeybee's body are pulled out and left behind, killing the bee. Although the bee dies, its sting takes effect quickly, and if the stinger is not removed quickly, the symptoms gradually increase as the venom sac continue to pump venom into the wound. Anaphylaxis honeybee stings are known to be very painful, but the symptoms that result from sting vary depending on the amount of poison that has entered the immune system of the victim. The initial pain eventually fades, but only after a period of swelling and itching. Some individuals may also experience visible signs, including skin redness around the sting. The structure, when we try to learn, venom sac is there, pulp, stylet, alkaline gland, lancet, barbs, venom gland, stylet, and lancets. Although the honeybee's sting is not commonly hazardous, some people may be allergic to the bee's venom and will experience such severe side effects as nausea, fainting, and in extreme cases, death. As the number of stings increases, the severity of the reaction also increases and can be lethal to anyone if stung too many times. Wasps, hornets, and yellow jackets are predaceous carnivores and live on other insects and sweet substances such as sap and nectar. Wasps are equipped with a stinger for self-defense. A wasp stinger contains venom, a poisonous substance that's transmitted to humans during a sting. Wasps also are aggressive, sting to attack, and can sting multiple times. Wasp having a venom gland and a sting apparatus. Wasps such as Philanthus triangulum use amides in which a polyamine is connected to tyrosine as venoms such as phenylandotoxin 433. The venom acts as antagonists of ionotrophic receptors such as the acetylcholine receptor. In contrast to bees, wasps do survive after stinging an aggressor. In female wasps, the stinger is modified ovipositor, which is an egg-laying organ. Over evolutionary time, this structure has adapted for delivering venom instead of laying eggs. The stinger itself is a sharp needle-like structure used to pierce the skin of the target. It is typically barbed, which helps in stay embedded in the target's flesh while venom is being injected. Attracted, Attached to the base of the stinger is a venom gland, which produces a toxic venom. Now, the stinger itself is a sharp, needle-like structure used to pierce the skin of the target. It is typically barbed, which helps in stay embedded in the target's flesh while venom is being injected. Then attached to the base of the stinger is a venom gland which produces a toxic venom. The venom is a complex mixture of proteins and peptides that can cause pain, swelling, and other physiological effects on the target. Muscles surrounding the venom gland help to control the injection of venom. When the wasp stings, these muscles control to pump the venom through the stinger and into the target. The stinging apparatus also includes sensory structures that help the wasp to accurately target and effectively sting its prey or aggressors. Acid gland, venom sac. Then alkaline gland, start of the system. Venom duct, sting, sheath, etc. can be seen. Then anaphylaxis, large local reaction to wasp stings include extreme redness and swelling that increases for 2 to 3 days after the sting. Nausea and vomiting can also occur. Anaphylaxis occurs when your body goes into shock in response to wasp venom. Severe swelling of the face, lips, or throat. Hives or itching in areas of body not affected by the sting. Breathing difficulties such as wheezing or gas, sudden drop in blood pressure. And then light headedness, loss of consciousness, nausea or vomiting and diarrhea, stomach cramps, weak or racing pulse. Then ants. Ants are insects from the Formicidae family. They range in size based on the type of ant, but are between 2 millimeters to 25 millimeters in length. These insects that defend themselves by biting. Ants are usually black, brown, or red in color and have segmented bodies, head, thorax, and abdomen connected by a narrow waist. Ants have 2 antennae and 6 legs. These insects that defend themselves biting with jaws and pincers on their heads or stingers on the bottoms if they feel threatened by humans. Most ants are not threat to humans. Fire ants. Fire ants are aggressive and venomous insects. Most often found in the southern United States, fire ants set their names because of ant sting releasing venom that feels like a burning sensation. So that's why they are named like that. Flying ants. The ants wants to expand their colony. The queen ant will create ants with wings. To notice head, petiole, castor, venom reservoir, poison gland, free filaments, diffuse gland, bulb of sting, then gonostylis. Anaphylaxis, what to do when this ant sting. Symptoms for an ant bite include a sharp pinch on skin, redness at the site of bite, mild swelling at the bite site. Symptoms of an ant biting sting include pain or burning sensation, redness and or swelling, itching, a small bump like a pimple on your skin that turns into a blister filled with pus. Allergic reaction from an ant bite include hives and swelling, then itchiness throughout your body, abdominal pain, tightness in your chest and or difficulty breathing, nausea, vomiting, dizziness. The next topic is maggot therapy, not related to the previous topic, but still we are going to learn this together. Maggot therapy involves the application of disinfected fly larvae to chronic wounds to debride the wound bed of necrotic tissue, reduce bacterial contamination of the wound, and enhance the formation of healthy granulation tissue. Maggot therapy is a form of both mechanical and enzymatic debridement and can be particularly useful in chronic and multi-drug infected wounds or in patients who have significantly contaminated and necrotic tissue but have comorbidities precluding surgical debridement. It goes after several names including biodebridement, larval therapy, and maggot debridement therapy. The use of maggot therapy in human medicine has been practiced sporadically for centuries. The most commonly used larva, Lucilla sericata, produces proteolytic and antimicrobial substances as well as ammonia in the gut and salivary glands. Ammonia is also produced. The enzymes identified include serine, aspartyl, and metalloproteinases, which lead to liquefaction and digestion of necrotic tissue and irrigation of bacteria in the wound as well as a change in pH, resulting in debridement, disinfection, and enhancement of the healing process. The maggots that are applied to your wound are very small, only a few millimeters in length. During the treatment time, they will increase in size as they clean the wound to a maximum of 12 millimeter. It is particularly helpful with chronic osteomyelitis, chronic ulcers, and other pus-producing infections that are frequently caused by chafing due to work equipment. For clinical use, disinfected eggs hatch under sterile conditions. Upon emerging, just prior to being packaged for delivery, hungry first stage L1 larvae are fed once in a high protein cereal based diet so that they can survive for up to 24 hours in transit. Once placed on a wound, the larvae can feed and grow to their final third stage. And they remain in the wound for 4 days before being removed. Life cycle of a medicinal maggot, Lucilla sericata. Female adult fly lays up to 3,000 eggs. Eggs separated and sterilized for clinical use. Sterilized in the sense, usually it is washed with alcohol. Then hatching within 24 hours. Then larvae, first stage larvae, L1 and 1 to 2 mm long and feed and grow vigorously, turning into third stage larvae, and 3 to 7 days later with a length of 8 to 9 mm. And larvae is also washed with alcohol and introduced. Okay, the striated maggots stop feeding and pupae in the dry place, giving rise to adult flies in 60 to 14 days. Debridement. In maggot therapy, large number of small maggots consume necrotic tissue far more precisely than is possible in a normal surgical operation and can debride a wound in a day or two. The area of wound surface is typically increased with the use of maggots due to undebrided surface, not revealing the actual underlying size of the wound. താഴത്തിലോട്ട് ഈ ഒരു മുറിവുണ്ടായിട്ടുണ്ടെന്ന് കണ്ടുപിടിക്കാനായിട്ട് നമ്മളിത് ഉപയോഗിക്കുന്നു. They derive nutrients through a process known as extracorporeal digestion by secreting a broad spectrum of proteolytic enzymes that liquefy necrotic tissue and absorb the semi-liquid result within a few days. Then disinfection, that means secretions from maggots believed to have broad spectrum antimicrobial activity including allantoin, urea, phenyl acetic acid, phenyl acetaldehyde, calcium carbonate, proteolytic enzymes, and many more. In vitro studies have shown that maggots inhibit and destroy a wide range of pathogenic bacteria, including methicillin-resistant Staphylococcus aureus, group A and B, Streptococcus, and gram-positive aerobic and anaerobic strains. Maggot therapy uses infection control. Maggots can help reduce bacterial load in wounds. They ingest bacteria along with dead tissue, and their digestive processes destroy many types of bacteria, including some antibiotic-resistant strains like MRSA, methicillin-resistant Staphylococcus aureus. Promotion of healing. Then the physical action of the maggots moving on the wound and their secretion of growth-promoting substances can stimulate the formation of granulation tissue, which is essential for wound healing. Chronic wounds. Maggot therapy is particularly useful for chronic, non-healing wounds such as diabetic foot ulcers, pressure sores, and venom stasis ulcers. These wounds often have necrotic tissue and high bacterial loads that impede healing. Then burns. In some cases, maggot therapy is used to treat burns that have necrotic tissue, although it is less common. Post-surgical wounds. Occasionally, maggot therapy is used for post-surgical wounds that fail to heal properly, especially when other treatments have not been effective. Then traumatic wounds. For wounds resulting from accidents or injuries that have become necrotic and infected, maggot therapy can be useful adjuvant to other treatments. Thank you for listening.